that's to some more unpleasant side effect than others. And for some, it's such a bad side effect that they don't like to take it at all. By the way, what did I do with that teenager who I couldn't give any?
Yeah, what did you do?
I gave her oral steroids.
Like a therapy treatment.
Yeah, I gave her 2 per kilo almost of steroids for the weekend. Because, she ended up in the ER. What can they do? And so by the end of the weekend, she was okay.
I said, what if they do in the ER, give her more Albuterol?
Yeah, well,
Yeah.
anybody here work in ER? Okay, I better be careful. But I mean, you know what goes on. This is not an easy disease to deal with in the ER. And maybe if we have time, we can answer some questions about that. So, that's a partial answer to your question.
Thank you.
Let me add one more thing. Breathing rate is not determined by the blood level. And breathing can be normal in kids who are in big trouble. And we'll come back to that about taking vital signs. Oh, sorry, all right. And kids, I don't know, how many of you work with teenagers or have teenagers at home? All right, what are they talking about all the time? How to be normal? What are the other kids doing? How good are they against their brothers or sisters in running? How about kids in the neighborhood on the playground? And in PE class, I mean, you guys remember what it was like. We were all pretty competitive.
Yes.
And part of our self-esteem was based on finding something we could do that was at least as good as anybody else around. Some of us had to work harder than others to find that thing. But it's part of character building, if you will, of getting self-confidence in yourself. If you start to cough every time you run, just think what that does to your self-esteem. Children are play. Play is children. Hopefully we can all play it for the rest of our lives, but if you don't develop a sense of play and how to have fun with physical exercise, that's a very serious impediment. Not much has been done about that, but those of us that have been around a while working with teenagers and pediatrics, it's out there. So at least half the kids will tell you they've had trouble. So what questions do I ask? I've got sometimes 5 or 10 minutes to go through an exam. So how are your grades in school? It's one of the screening questions I can find out if everything's falling apart. Oh, I get good grades. The next question I can ask, how do you do in PE? I get D's and F's. There's only a few things that give you D's and F's in PE. One is not going, and the other is not being able to run 5 or 6 laps in the physical fitness test. So that's a red flag. What happens when you run? Well, I can run a lap or 2, but then I have to stop because I'm out of breath. Like other kids, no, mine seems to be different. Do you cough? Sometimes. So that is a sort of subtle clue, but over the last 6 months I found it to be very effective. If they can run 6 laps, I worry less that they have asthma. And remember, if we see 20, 25 kids in a day, 4 or 5 of them are going to have asthma. And my experience is that many kids, and I'm sure it's the same for adults, are underdiagnosed. They've been given cough medicines called as having bronchitis and some other things. Asthma is not a reason for a physician to give a note to the student that he doesn't have to take PE. And we can discuss that later in questions. I'll just make that as a blanket statement. It means that our team has not, is either ignorant of or hasn't correctly applied the known guidelines. Remember, I said people are winning gold medals in the Olympics. They should be able to take PE. Okay, asthma is not an easy disease to understand. See, what time?
You're fine.
Okay. I'll give you a warning when I'm close. We did a press conference a couple of weeks ago, and I'm trying to think, how do I explain asthma, not only to patients, but to people who have no medical background? I thought, asthma is a chronic inflammatory disease, and we have some other ones that people can see, like rashes on our skin. Asthma is like having a rash on your skin that sort of makes you itch and hypersensitive. But asthma is a rash on the breathing tubes. And that rash you can't see, so you don't necessarily know it's there. And like the rash on your skin, it's irritable, and your lung tubes can become twitchy. And that's what we call an exacerbation of acute asthmatic attack. But the inflammation is there all the time. Even in so-called exercise-induced asthma, when they actually go in and look with the bronchoscope, the inflammation is there all the time. What is inflammation? It's what keeps what's outside from getting inside, basically. We have a skin so that germs can't get in. We have linings on our gastrointestinal tract, in our lungs, even in our nose, and lots of other places that keep things outside that should stay outside, and things and stuff that's inside from leaking out. Now, inflammation causes a variety of inflammatory cells driven by the immune system to recruit eosinophils, neutrophils to the epithelial cells that line these cavities and surfaces. That leads to obstruction and spasm of the airway. It's widespread in the lungs. You can't really hear inflammation when you listen with a stethoscope, and obviously you can't see it. But it's in all the breathing tubes. It isn't limited to one lobe or another lobe. It's variable. Some tubes have more narrowing and spasm than others, but it's reversible. And that's the whole reason why we're here, because we like to treat diseases that we can treat. And this is eminently treatable. We've talked a little bit about the symptoms. And you have to have an index of suspicion, as we say. You have to be aware that the patient may not be able to explain to you or the parent what's going on. Sometimes they'll talk about phlegm or toast at a certain point, and they're not sure themselves about what's going on. But it's a nighttime cough. They may cough so hard that they have throw up. So I'll look at the chief complaint sometimes. It says vomiting, but I'll ask, does he cough before he throws up? Yeah, and they cough, 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 and up it comes. That's not really vomiting. It's post-tussive emesis in a formal way. So you have to be careful what is causing the vomiting. All of you, I'm sure, have coughed so hard sometimes that you feel like you're going to throw up. Well, that's what happens to small kids. Now, over time, the chronic inflammation, just like having eczema for a long time, can change the lining of the airway. Just like you can get skin that's tougher and rougher and irregular, like lichenification from eczema. The same thing can happen in your airway. We don't know if we can prevent that. We suspect that by using steroids we can. And we'll come back to that point. One of the other things that you could think about is that sometimes when you have a rash, especially if you have something like poison ivy, the skin's a little leaky. Stuff comes out.